On behalf of UAF Summer Sessions and Lifelong Learning, I'd like to welcome those of you in the room, as well as those watching via live stream, to this evening's Discover Alaska lecture. My name is Wendy Ward. I'm a part of an organization for educators called Delta Kappa Gamma. Members of our organization will be introducing the Discover Alaska speakers this week, and each week. At UAF, we acknowledge the Alaska Native Nations upon whose ancestral lands our campuses reside. In Fairbanks, our Troth-Geddah campus is located on the ancestral lands of the Dene people of the lower Tanana River. This year, Discover Alaska lectures are presented by the UAF Institute of Arctic Biology faculty members. Tonight we will hear from Kelly L. Drew, Professor of Neuropharmacology. Kelly Drew is a prominent researcher and expert in the field of hibernation biology. She is a professor in the Department of Chemistry and Biochemistry and Institute of Arctic Biology at the University of Alaska Fairbanks. She directs the Center for Transformative Research in Metabolism. Her research focuses on understanding the physiological and molecular mechanisms underlying hibernation in various species, particularly the Arctic ground squirrels. Kelly Drew and her research team have made significant contributions to the understanding of hibernation, including its potential applications in fields ranging from basic biology to human medicine. There will be a question and answer section at the end. We are asking of any speaker to please use the microphone, or it will be inaudible to those watching online or later on YouTube. Let's give a warm welcome to Kelly Drew.
Thank you all for coming. It's such a beautiful night. I really didn't expect anybody to show up. So, and hopefully, it can be a little bit of a conversation. It's more fun to ask, a bunch of little kids. They usually want to go. I think right now it's supposed to be just a one-way trip. But it's something interesting to think about because we've seen it in the movies a lot, So before I get into really talking about the big picture, let me explain a little bit what that introduction did. But my background, my training, I'm from Alaska, I'm from Fairbanks. My undergraduate degree is actually in psychology, and that's how I got interested in the neuro side of things. And then I went to graduate school in pharmacology, which was at a medical school, all biomedical stuff, rats and mice. And so then I came back to Alaska after I'd done a PhD and a postdoc, and there I was being my little biomedical scientist on rats and mice, and Brian Barnes walked in to where I was working, and he hands me this hibernating ground squirrel. And it was absolutely amazing. I had never seen anything like it, because the hibernating animal has its own state of consciousness that we can't even, really appreciate. I mean, maybe anesthesia is kind of like that, but not really, because they're out of it, for the most part. But they're breathing, they're regulating their breathing, they're regulating their posture, and they're in a survival mode, which is really different than anesthesia, different than coma. And so I just was taken by this state of how the brain could be functioning when it was cold. And when you measure brain waves in a hibernating ground squirrel, they're flat. It looks like they're comatose or dead. So it's just amazing how their brains can function and what it's all about. So yeah, I started to see what we could do with them. One of the things had to do, there was a recent paper that suggested that hibernation could be a model of tolerance to things like stroke or cardiac arrest, where the brain dies from a lack of blood flow. Because these animals, when they're hibernating, their heartbeats go from like 300 beats per minute down to 6 beats per minute. And the blood flow in the brain goes down to about 10% of baseline. And And so if you looked at them from a perspective of having a stroke, it would look like they're having a stroke. There's no blood flow to the brain. And yet they go through this and they warm up and they're fine. In fact, we think maybe even they're better. We think that it's kind of like a regeneration period when they re-warm. So that's what kind of got me started. And so in terms of biomedical applications, I was interested. And also in terms of how the animal functions and what it does. It's amazing. And along the way, you know, people have always thought about hibernation for space. It's in the movies anyway, right? And it turns out that it was really fun. I'll tell you more of the story when we get into the slides, but I had been, you know, talking about, we kind of discovered a mechanism in the brain that induces hibernation, and we have been and still are trying to mimic that with drugs to induce a state of hibernation that's similar to what ground squirrels do in a human. So right now we're pretty much doing rats, but we tried it in pigs. But anyway, the point was that I was in the midst of all this, and we got this call from a company called SpaceWorks Enterprises. And SpaceWorks had gotten a grant, a proof of concept grant from NASA to design, just on paper, go through the theory of a human hibernation habitat. And so I got to participate in this group that were the SpaceWorks engineers. So there were 2 engineers and the CEO, he was an engineer also. We had 2 critical care physicians, and we had an astronaut, and we had me. And it was so much fun to, you know, have this conversation about what it would take to hibernate people to go to Mars. And it was really interesting because the engineers they cared about payload. That's their main deal. They were trying to decrease payloads, so they were really looking at how much energy you could save. And then the clinicians, their critical care, because cooling is actually used in medicine, in critical care. They'll cool people for after cardiac arrest, and babies who are born without sufficient oxygen. Standard care, they cool them for 3 days. And so this is where the clinicians were coming from. And they were like super invasive. I mean, they come from the ICU perspective. So they were going to be, you know, sticking tubes in the astronaut and, you know, first going to feed him by IV, and then they're going to feed him with a tube down the stomach. And then they decide they're just going to put a tube in the right here through the side, and you know, having to you know, have these chronic IV cannulas. And so anyway, the clinicians were all on board with this, but the astronaut was saying, I don't think so. I don't think that sounds like a lot of fun. And in that time, I got to suggest the hibernating bear. So bears are super awesome because they're kind of human size, for one. So the folks here studied the black bear, and so they really are close to human size. And they don't get so cold. Like, they get down to about 30 degrees C, and so it's something that humans can tolerate. And so anyway, I started telling them about the bear, and told them about how the bear kind of goes in and out of low temperature and higher temperature. And they adopted it. They adopted that concept in their design. And the engineers weren't really happy at first because they don't save nearly as much energy. But they did the calculations and ended up developing their thing around that. So that was pretty fun. And that's kind of what got me into this hibernation for space. I've always thought, you know, because I saw the movies, that it would be good. But I'll try to tell you a little bit how that applies. So, do I point this? Where do I point this? There we go. And so along the way, I started this little company. I call it Be Cool Pharmaceutics, and it's really to help what we call translate. So commercialization is kind of a weird area, but it really focuses on what you have to do to get from rats into humans. And so I declared that as financial conflict of interest. It would be amazing if in my lifetime if there was any money, but I say that anyway. So a lot of this activity also inspired the creation of this center. So, you know, UAF has had people doing hibernation research for the last 60 years or even longer now, and many people have got into that because of the activity And there was enough activity around that that it made sense to have a center. And that center has brought people together, really with a focus on this whole idea of translating. So how do I get my little pointer? Yeah, the translating hibernation research to improve human health. This is the theme that we all kind of get around, and I'll tell you where it begins and where we think it will go. But I just was at the International Hibernation Symposium. They have it every 4 years. And it was amazing. It was a 4-day meeting, and probably 2 days were devoted to this aspect of translating to human health, using lots of new genetic molecular tools. And so anyway, there's a lot of interest in it now, and we hope to be able to stay on board and be part of it, the process. So anyway, if you don't recognize this, is the Berkshire range. This is a trap that is used to get these little guys. And this is the Arctic ground squirrel. So it's a species that I was introduced to, and what we have that is really a natural resource for us here in Alaska. Because, well, you'll see that Arctic ground squirrel is kind of famous for some of the things it does. So I know you can't read that. I should have fixed it, but let me see if I can read it, if I get really close. So these are some of the health risks of space flight. So there is this lots of trouble with the lack of gravity on the skeletal muscle system, but we also have this problem with adverse cognitive or behavioral conditions, because you can imagine, I mean, we can relate to cabin fever, but can you imagine being in a space capsule with, you know, maybe 8 of your not favorite friends that have to work together? So anyway, there's a lot of that. And then celestial dust is really, I don't think they use the right word, but it's ionizing radiation. So a lot of ionizing radiation. And that is probably the biggest concern for NASA, because right now it's the most deadly, and it's really difficult to block it. You can't block it. You can't, you know, fly a lead-lined spaceship. So they've tried different materials to absorb, and you know, cosmic radiation is much more penetrating than a lot of the radiation we deal with on Earth, and so it's really hard, and that's a big deal. And so they're interested on health microorganism interactions, immune response, and then this is also just emergencies. So decrements in performance due to medical conditions. So that's where I think of it more as emergency care. And some of the other bone fracture. So there's, you know, because of lack of gravity, your bone and your muscle tends to atrophy because you don't have that resistance training or resistance action. Let's see. So this is also bone and also muscle size, strength, and endurance. And so there's a few things that hibernation can address. So this whole radiation and carcinogenesis, that's another thing that's the outcome of all the radiation, ionizing radiation. And then this one, neuroocular syndrome, it has to do with increasing pressure in the brain, which compresses the optic nerve, and then they get, when they come back to Earth, they can have vision issues. So, so there's a lot of risk to space flight, and this is the synthetic torpor might mitigate some of these risks. So hibernation is defined as this prolonged torpor, and I'll come back to it, but I refer to the word torpor if you're not familiar with that word. It just means cold and very metabolically suppressed. So this whole idea is what we see here. What these people are doing in the picture, this actually is one of the pictures that Space Force came up with, and we're going to call it synthetic torpor. So hibernation in a hamster or a ground squirrel is hibernation, and a human, we're going to call it synthetic torpor. And so it's thought that they can address these cognitive or behavioral conditions, this neuroocular syndrome, and impaired performance due to reduced muscle mass, strength, and endurance. So I'll talk about some of those things. But here on Earth, and also it could apply to the to NASA missions, is this remote emergency care. So like I said, cooling, and this is an actual patient, is standard of care for cardiac arrest and also for babies. And so the idea is, actually standard of care is not that they don't cool in the EMS don't cool. When the ambulance comes, they don't cool you because clinical trials have not shown it to be successful, partly because it's difficult to cool people. So usually what happens is it's what's called in-hospital cooling. So you have cardiac arrest outside of the hospital, EMS will show up, get you to the hospital, and they start the cooling protocol. But being able to do that in the EMS setting could be helpful if we could cool more effectively. And more importantly, for remote emergency medicine, it can extend that time. It can stabilize a person and protect the brain or the heart until they can get to the hospital. So those are, and this is similar to what could happen for space. It's not so much if you're going to Mars, but NASA now is switching their emphasis from going to Mars and the space station to the LEO, the low Earth orbit. So they want to go low Earth orbit and go to the moon. So this remote emergency care now applies. And it also applies to Alaska, you know, where you can, time to get medevaced out can be really delayed. So hibernation is this energy conservation. So there's two things about it. They save a whole lot of energy when they hibernate. And so here's one guy hibernating, this one. And they also have this enhanced anabolic sensitivity. So that's what I'm talking about, this regenerative thing. And this is going to relate to bone and muscle loss. This is going to have to do with payload and some of the psychiatric issues that that we get. Okay, so what is hibernation? We'll play this, maybe.
but the ground squirrels are not just outside in the, on the patio or something.
Right.
They're in an area where they're cold, but they're not as cold as they could be even.
They're not as cold as they could be, but they still get pretty darn cold.
They get pretty cold.
Yeah, I mean, core body temperature, the Arctic ground squirrel go down core body temperature -3, so below freezing.
Yeah.
-3°C, you know?
There was a lady who was teaching a class, or it might be one of the people you
Yeah.
there, and she brought this ground squirrel and passed it around the room, and it was just all asleep and everything. You pass, sure enough, it's alive, but it's just
Because,
Do they stay in the same circle?
oh, there we go.
Does the squirrel stay in the same circle, or does it come out like the deer does occasionally?
It they've done it for 24 hours, and now they're just starting a study to do it for 5 days. So apparently the people can get up and eat a little bit, and so they're not trying to do IV or anything like that. But this is a NASA funded, their project is a NASA funded project. So 5 days will be very interesting. And, but I haven't, the bottom line of how comfortable it was, we still haven't gotten a final answer on that. And, you know, it's pretty interesting though. So it wouldn't be too bad, like just to sleep a little deeper, you know, in winter, let the December go by a little faster. But the question is, you know, like is the cold and the rewarming going to do that same anabolic stimulation as it does in the hibernating animals? Because then it would be okay. Right now we can't just sleep because we don't have that benefit. We have to get up, we have to move, we have to eat. But it'd be interesting. Yeah?
So you showed how the...
Here.
Oh,
Oh,
thank you.
right.
Thank you. Okay, thanks for the great talk. You showed how the neurons grow really quickly after they awaken from hibernation, but how much do they experience neurological decline while hibernating? And I guess what I wonder is, do they remember anything from before?
Oh, so that's really interesting. So the story has that there's been a little bit done, and they do forget some things that from over the hibernation season. They tend to, what they did remember was their buddies, their conspecifics. But, I mean, these guys don't cache. The males cache a little bit. So, but yeah, so other things they forgot, but their buddies, they remembered. So it was memory type specific. So they do lose a little bit, but then the thing is that during that rewarming phase and that sprouting, it's at that time they can learn better. So it's not that they haven't lost, but they can acquire new memories better. Yeah, so that's interesting. So yeah, you might forget you might forget where to go shopping or something, but you know, but you can learn it quickly. You can relearn it quickly.
And I have too many questions. I might get your email and ask you later, but and I apologize that even with the hearing aids turned up all the way, I read lips. So
Oh, I'm
I miss it.
sorry.
It's not your fault.
Okay.
And actually, I hear you a lot better. I wasn't here Monday, and it was a friend of mine was speaking, and I couldn't.
Okay.
I just didn't get it. Now, you may have answered some of these already. I've read that, and it's University of Alaska, when the squirrels have to, in effect, not thaw out, but warm up enough every few days to dream. Is that true?
Some people think so. That's one theory. It's somewhat still controversial. That there's no question about it that they do dream during that time where actually it's not really dreaming. It's called non-REM sleep, which is not really dreaming. That would be REM sleep. But the non-REM is what is thought to be restorative sleep. And so they definitely show non-REM sleep, but whether that is whether there's a deficit of sleep while they hibernate is still controversial.
As a psychologist, pharmacologist, this is the perfect question for you. So, you know, what is happening with their brains? I think Einstein had a pretty good IQ, but what he said is logic will get you from point A to point B. Your imagination will take you anywhere. And what he was particularly good at was imagination. And his brain, because his brain was, a lot of people had chunks of his brain, it just had a lot more connections. So when you talk about sprouting neurons, there's a lot more to this than hibernation. How can we sprout more neurons, especially as we get older? I'd like to sprout a few more neurons myself. And this, you may be touching on this, which to me is a lot more important question. You probably know about Mark Kelly. He may be our next vice president. Arizona senator, married Gabby Giffords. Mm-hmm. So there's like two questions there. You know, Gabby didn't get her ear neck. She took a bullet in the head, and she's still functioning, but obviously not so well. So a lot of this information may help her. In addition to that, Mark Kelly's twin, and his twin didn't go into space. So you've got a comparison there.
Yeah, there's a lot written on that. There's a huge report on that published paper. Have you seen it?
No,
I will find it and send it to you.
Okay.
It's really interesting.
but it's more important that what you think about it, because this relates to what you're talking about. Also, we probably read that, and by the way, cut me in if you ask a question. How many people live longer?
So it's supposed to extend life. They've done that with a long time ago in hamsters. Just the process of hibernating. Those animals live longer than animals that were not allowed to hibernate. So it supposedly extends life, but the reason is thought to be that there's just metabolic suppression.
Okay.
Yeah.
Athabascans lived longer
Right.
in the old days. And this is something, because what you're saying here kind of relates to, what can I eat that would help me, and how would it affect me differently. There's also a question I've asked a lot of people, and it seems crazy. But if we had, and the technology certainly kept good track of what we ate. I have a little scale there, and I ate this much, and then try different diets. And I'd like to donate a blood drop a day to myself. What I want to know is exactly what I'm eating, or that is how it affects me, to the point where if I take a supplement, AI could say, this is the discrepancy. I'm praying a little long enough to see a smart toilet that gives me hell about
Right.
But because I travel more than anybody I know, 30 trips out of the country, more than 5 months each, I lose a lot of weight when I travel. But I go for 5 months at a time. People say that's because you exercise more. Wrong. I got COVID 3 years ago, and I felt like I walk very far, and I sit down a lot. Here, I'm in the gym with a bunch of people who are much younger than I am, and I exercise a lot more here. So after 2 months in the gym when I got back, and I skipped during the plague years, but so my instructor says, well, let's see how much weight you lost. I said, I haven't. Feels like I have, but I haven't. He weighed me after 2 months. I gained 7 pounds. And I'm covered with sweat when I get out of the gym 3 times a week. And he said, well, it's muscle. I said, no, it's not. So we did the BMI, 2.5% more body fat. So I tell people, it's not the Mediterranean diet, it's not eating American food.
Yeah.
And people think I'm a vegan because I just eat a live off of vegetables and nuts and stuff like that. No, I go to Peru and eat bacon and eggs every morning and the weight falls away. So that links into your study. So being a psychologist, pharmacologist, how can we test and establish a relationship between what we're eating and how it affects us, and come up with the answer. Kids drown and come back sometimes.
Yep.
How's that? And occasionally an adult will do it.
Yeah.
That's got to play
Very
into it.
relevant. It's all about the benefit of cold tissue temperature when it's deprived of nutrients and oxygen. If it's cold, it does better. So there's all kinds of anecdotal stories of people drowning in cold water and coming back after extended periods of time. And the kids also. So the tricky thing on drowning, though, is depending on how cold they get. So if they get too cold, then it's that warming is the risky part. And so the best way to do it, what they do, they actually take the heart offline and do a cardiopulmonary bypass. And then they can rewarm the body and then put the heart back in so everything's back to temperature and working, and the brain does well because the brain was cold. And
So with the squirrels, the body temperature, you use the word body temperature 3 times. What was the brain temperature?
oh, the brain is also just as cold, the whole body. The brain temperature might be a degree warmer.
It might be a little.
Yeah, a little bit, no more than a degree. Oh, we got one more question.
Yeah.
Or maybe comment on that one, that, yeah.
Well, yeah, kind of. So there's some people that are interested in living longer, not just living longer, but living better longer.
Yeah, higher quality, yeah,
And
right.
there's this ice bath and this, but for most humans, their head is probably not in the ice bath.
Right.
So it's only their body, but do you think they get neurogenesis? I mean,
I don't think that's, their core body temperature doesn't really cool.
because they're not in the ice bath
Right.
long enough.
Right. I mean, I think it would reduce the
Yeah.
heat from, if they're hot, getting in there. But they're not, generally what happens, normally, if we go into an ice bath, we shiver. So it's really hard to lower core body temperature.
Right.
And that's the idea, is that lowering core body temperature is what's helpful, but you need to be able to manipulate the heater, you know, the thermogenesis, to turn it off so your body's not fighting it and having a high metabolic demand trying to stay warm.
Well, and the whole thing, like in Finland with the sauna studies, that having these temperature changes may be really valuable
Yeah.
for human health.
Yeah, and that is different though. That's
Yeah.
a different phenomenon that I'm actually not that familiar with. But those would be, and especially cardiovascular, because you know they get the heart up and then jump in. I can't remember all that happened, so that's probably more related. This phenomenon is more relevant to intermittent fasting. I think so in terms of, you know, being able to say exactly what to eat is harder, but two things about hibernation. One, intermittent fasting, and the second is ketogenic. Because they just completely stop eating, but, and so they go very ketotic. Yeah, so those two things I think have the best chance of mimicking some of the metabolic changes that we see in these guys.
And I was going to make a comment for you. One thing you might look at is it's a program called Levels, Levels, and it was started by a space engineer and a physician who quit traditional medicine when she was like 3 weeks from finishing her ENT residency after a bazillion years of school and training, to start this company that is providing feedback. And they do that with a continuous glucose monitor. So if you don't sleep well, your glucose is going to be higher. If you do fasting, it's going to, you know, lower your insulin. We don't have a good way to track insulin out of centers, but the glucose monitoring may be really, really key with what you're eating, because everybody's different. I mean, grapes might spike my insulin and not yours. So if
Is that like a sub-Q thing or a?
It's interstitial space.
Okay, it
It's
sticks in a little bit, but
patch
yeah,
that you put on and you change it every 10 days. There's an app on your phone.
that's amazing.
And normally you have to have a doctor prescribe it, but if you sign up for this program, it's part of the program. And then they also have a number of biomarkers that they want you to test every 3 to 5 months that include things that they think are really important.
And then you can see how that's responding
Changes
to your diet and your,
and exercise
yeah.
and sleep is huge.
yeah,
So,
right.
Levels is too generic. What's the fellow's name?
Casey Means is
Casey
the,
Means.
is the physician.
M-E-A-N-S?
Yes. And she has a book out called Good Energy.
And I might even have it, but I need to, I've got too many books I need to double check.
Yeah.
Thank you.
On the slide with the imagery of the brain both in and out of torpor with the probe,
Yeah,
where you talked about the immune response out of torpor and then basically a non-immune response of any sort during torpor. Was that something replicated elsewhere in the body, not only in the brain? And if so, could you like speculate or conjecture any sort of implications as to maybe susceptibility of disease or other foreign bodies?
that's a really good question, and no, we haven't done a lot, but Anya Gord-Krishnaya has just now begun to look at muscle. So, and particularly kinds of types of muscle injury that cuts the blood flow off to see how it responds and whether it avoids its immune response, and to characterize it and see if it's helpful. And that's particularly relevant to things like peripheral artery disease. I don't know if you heard about that, but that's what happens when you get older. Sometimes you lose blood flow to your lower legs and leads to amputation and all kinds of bad things. So it's just like, it's slow. But the question is really awesome. Okay, so I should back up. Other people have looked at ischemia, the lack of blood flow and return of blood flow, ischemia reperfusion in liver and in the gut. And so it hasn't been a stab wound like this, but the ischemia reperfusion, and it's in a different species. It's a 13-line ground squirrel, and those guys show also tolerance, but they're more tolerant in the hibernation season, whereas we haven't seen the benefit of the hibernation season per se on these guys. But yeah, so I guess that's also relevant, and it is definitely the immune response is very much suppressed in the whole scheme of injury. The immune response is one of the suppressed immune response is one of the things that are thought to be reduce the injury.
Is that something that you observed maybe when they were emerging from torpor in the lab, maybe like with infection or other systemic?
Yeah, there was a case, so they have very little immune protection in torpor. And so there was a case where there was some, it was actually a staph eating, it was a flesh-eating staph that got into the colony. And these guys, it was awful. It was awful. So what happened is that while they were hibernating, they looked perfectly fine because they were refrigerated. And so the bacteria were not dividing, but as soon as, but they had no other immune response. And then as soon as they warm up, then the bacteria could divide, and it would just like, you would see these horrible lesions. And finally figured that out. But so, yeah, they're very immunosuppressed in torpor, but cold temperature helps. It's like another way to keep the microbes and the pathogens away, at bay.
Yeah.
But they don't need immune. So I still don't know if I answered your question, though.
No, that was helpful and I think a little insightful to help think about it. And then my last question on this whole vein that I just thought of then, is that something that you see as well in the bears? Has that been
That
established?
hasn't been so well studied.
Okay.
Yeah, the immune response, I am trying to think. They have the Scandinavia Bear Project, and there may be some stuff done there that I can't remember. Because that was a super cool thing. Those were all free-ranging bears, and then when they would euthanize a bear, they just shared internationally these samples, and there's a lot of work being done on that. And I can't remember immune, though, but it may be out there. Good question.
Thank you.
Yeah, thank you.
We still got time?
Yeah, feel free to leave.
Or I can just email you.
Okay, yeah, that'll be good. All right. Well, thank you all so much.